It is Thursday, October 9, 2025, and I am coming to you from Albany, New York. So good morning to those of you on the West Coast and the Mountain Time Zone. It is 1 p.m. here in the Eastern Time Zone, and I am reporting to you from the Department of Health's Office of Healthcare Workforce Innovation. You'll see it highlight on the screen. That is the Department of Health office charged with administering this program. Today, we will cover the topics shown on the screen, and we're going to focus on the quarterly reporting package. We will show some examples of quarterly reporting along the way. As you may have heard, the webinar is being recorded, and that will be shared to all of you via our webpage in about a week. We ask that you place any questions you have in the chat window of the WebEx. Members of this team here are going to respond in the chat window for all attendees to see. Attendees will be muted for the duration of the webinar, so your communication method will be the chat window. Our aim here at the Department of Health is to address as many questions as we can with the chat window during the time allotted. We may, however, ask you to send your question directly to our office email box if we are unable to respond to all questions today. Thank you. So, an overview of why we are here. In 2023, I see some people that they might not be able to see the webinar. Okay. It says I'm sharing my screen. I'm just going to pause for 1 second. Okay. So we have confirmation from attendees that the webinar is in fact visible. If you are not seeing it, you may have something on your end that you need to adjust. Okay, so in 2023, Article 29K was added to the New York State Public Health Law requiring temporary healthcare service agencies and healthcare technology platforms to register with the Department of Health. That's a lot of words. So, temporary healthcare service agencies and healthcare technology platforms are businesses that provide or procure healthcare workers to New York State healthcare entities. Again, a lot of words. So rather than my saying temporary healthcare services agency, I'm just going to say the word agency. And rather than say New York State healthcare entity, I'm just going to say the word entity. And I will be a little particular with that throughout the conversation. So, temporary healthcare service agencies are businesses that provide or procure workers to entities. Agencies provide workers to entities. That's the takeaway. So, what kind of workers are provided? Well, healthcare workers are the ones that are provided, and they are defined as nurses, certified nurse aides, and licensed or unlicensed direct care staff provided by the agency to provide temporary services in a healthcare entity. Okay, there's those magic words, agency and entity. And what's underscored is direct care. So I'm going to take a moment and explain that should your agency have a contract with a hospital, an entity, and you are providing, let's say, a registered nurse, but they do administrative work, they do medical coding only, and no direct care. Well, they do not fall under this umbrella. It's only the workers that provide direct health care. So 2 years ago, 2023, the Article 29K was established, and the New York State Department of Health was charged with administering the program, and we made a website. I'm showing the website on the screen, and you should write it down. I know it's long. I promise you I will show this at least 3 or 4 more times so that if you miss it right now, you'll see it and capture it throughout this webinar. But it is www.health.ny.gov. That's the Department of Health website. And then /facilities/staffing_agency. So let's take a look real quick. Here is the website I just said to you. And what I just want to show you is we really strive here at the department for brevity. So we think this is pretty succinct. At the top of the website, you will see the stuff I just read to you, the overview. Okay. In that overview, you can link to the article. Peter, I want to see the article language. Well, that's right here. Okay. And if you want frequently asked questions, they're right here at the top of the page. Okay. Also, our direct email box here at the Department of Health is at the top of the page. So where's the article? Top of the page. Where's the frequently asked questions? Top of the page. Our email address is at the top of the page. Our email is also at the bottom of the page. But after that, you're going to see a small section for registration. Okay? How do I register, Peter? That's right here. And there's the end. Here's the quarterly reporting section. Again, very succinct, and there's the end. And there's a small section about how to submit data. And I'm going fast on purpose because I'm going to come back to this later. But I just want to show you the sections of the website. Here's information IT related on sending us the stuff via SendVault. And then at the bottom of our site, you'll see a list of the agencies. You say, Peter, I should be on that list. Well, you are. You can link to those lists. Here are the trainings. They're all webinars, previous webinars. This is where we will post this webinar, today's webinar, in about a week. And then there's some reports, and as promised, there is our our email address again, okay? So if anything you remember today, it should be this website, and you will be able to find all these resources. But I will continue to show that website throughout here so you can write it down. So we talked about the statute, and it says agencies must be registered. Well, what does registering mean? Well, being registered requires 2 things. It's completing an annual registration application every August, and then completing a quarterly report package every 3 months. So the registration part, number 1, is outlined on that website that I showed you, and it will not be covered in today's session. Good news, it's pretty self-explanatory. It occurs in August. You're due for registration, like your automobile, maybe your automobile registration. It's every August. Probably June and July, you can start sending in registration applications. Okay? But to remain registered, you have to take action every 3 months. So to remain as a registered temporary healthcare staffing agency, you must send a quarterly reporting package to us, and you have 2 months to submit it at the end of each quarter. So here are the quarters of the year on the left side. The quarter 3 ended last week, right? September 30. So you'll have all of October and all of November to send us the quarterly reporting package. For those of you that are planners, at the end of December, you'll have January and February to do the same, submit the quarterly reporting package. So what is this quarterly reporting package? Well, it's 5 items. It is a quarterly reporting Excel file, then it's Appendix 6, 7, and 8, and a compendium of your invoices. Those are the 5 items. Today, though, we're going to focus on number one, which is probably the most time consuming. So today's webinar will show us how to complete the quarterly reporting Excel file. Now, how do you get that Excel file to complete? Well, that's on our website that I just showed you. So when it's time for you to complete the Excel file, you should go to the website and download the latest version. And you should remember at the bottom of the screen here, it says, remember to clear your browser's cache. And what that means is your browser, without getting too far into this, your browser will have a small memory that says, hey, if you've downloaded this previously, then we're going to remember it so that we can serve you quicker. But if you don't clear the cache and you download, you will receive the old version that you downloaded previously. So I'm going to just show you that. Let's make sure you see that. Now, of course, I can't show you every browser. I'm in Google Chrome, but your browser should look similar. And you'll have an ellipsis, maybe 3 dots up in the right-hand corner here. And you can open that to open some settings. And right here, it says delete browsing data. Okay, if I click delete browsing data, it will open up a dialog. And it says, hey, do you want to delete your cached images and files? And you can just hit yes, delete the data. And then you will be back to square one. Okay, so how do you get the file now? You've deleted your cache. You go down past the registration part till you get to quarterly reporting instructions, and you will see the 5 items I just showed you on my screen. Here they are. The first of which you will click on to download the Excel file. Now, let's get back. So now you've cleared your cache, you've downloaded the file. What do you do? Well, pause for a moment. I promised you that I would show this website address a few times throughout the webinar. So you're starting to see it's a valuable resource. If you haven't written it down, you might want to jot it down. health.ny.gov/facilities/staffing_agency. So you've downloaded the file. What are we asking for here at the department? Well, that Excel file will collect financial information and demographics about the healthcare workers. So you'll see some characteristics listed here: hourly pay rate, overtime rates, shift differentials. These characteristics, also the state and zip code in the second bullet, these characteristics come directly from the statute. So coincidentally, that Excel file has 5 tabs in it. The 5 tabs are an agency info tab plus tab 1, 2, 3, and 4. I will show you those starting with the agency info tab. The first tab in that Excel file asks you information and characteristics about your agency, not the workers. So in the first blank box below question 1, you'll put your agency name. Okay, there's no pull down menu for that. But item 2 says select the reporting quarter, and you would pull down the box. You'll see Q1, Q2, Q3, Q4. Seemingly, you'll be doing this for Q3 momentarily, right? In the next 2 months, you'll be reporting Q3, July, August, and September information. Put your agency ID in the next cell, item 3. Oh, Peter, I forgot my agency ID. Well, I told you there are lists on our website of all registered agencies. Those lists will have your agency IDs. I'll show that at the end of this webinar. Item 4, the name of the person submitting this report. Understand, it might not be the director, right? It could be a finance manager. We want the person who's responsible for submitting this report in case there are questions. So item 5 and 6, ask for the email address of the person submitting the report and the telephone number in the event we have to contact someone. Item 7 says, is your agency a vendor management system, a VMS? If you say, Peter, what is a VMS? Then your answer is no. There are some agencies, however, that want to relay to us that they are a vendor management system and they should select yes from the drop-down menu. And then a very important question, number 8, even though it's at the bottom, it's probably one of the most important questions on this tab. It says, did you have at least one temporary healthcare worker this quarter? And it's a yes/no pull-down menu. If you had no temporary healthcare workers, you select no, and you are done with this Excel file. You do not have to complete the remaining tabs of this Excel. Remember, the quarterly reporting package had multiple items though. So if you'll allow me, I'm going to scroll back a few pages here and show you what the package contained. So the quarterly report package contained this number 1 Excel file, but there are other appendices that you will still be required to submit. So if you placed nobody, you are a registered agency, and you placed no one this quarter, you must complete item 1 telling us no workers during the quarter, right? That's the item I just showed. And then you must complete item 4, the attestation. Obviously, item 2, 3, and 5 you would not have if you had no workers. So I'm going to scroll back down. Here's where we were. So that 8th question, did you have at least one temporary healthcare worker is important. Most of you will say, yes, we did place workers this quarter. And then we'll go on to the next tab called tab 1. Tab 1 is really the guts of this Excel file. It asks for wages and billing. There are 7 columns. That's it, 7 columns. But it creates a little bit of anxiety for agencies, and we often field questions here about it, hence this webinar. So you will see that column A asks, and I'll go through these one at a time, but column A asks you to provide, where did you put the worker? What healthcare entity? And then B, you'll tell us what was their job category. Were they an RN? Were they a CNA? Were they a radiologist? And you'll say how many. You might have put 2 radiologists at the hospital. How many workers? You'll tell me what type of pay you gave them in column D. Was it regular pay, overtime? Did you pay stipends? Then you'll tell us the hours that they worked, the total hours. For all the workers in that category, their pay to the worker in column F and the amount billed to the entity in column G. So take a look at them one at a time. Column A, healthcare entity, has a pull-down menu. It's a large pull-down menu. It has thousands of outcomes in it. But the good news is in the white box below the yellow box, that's a search feature. So if you're looking for something, you don't have to scroll through 3,000 outcomes to find it. If I type in the word Brooklyn, I will get every outcome that contains the word Brooklyn. I will show you this live at the end of this session. Column B says select a job category. So you've selected where they were stationed. Now you tell me the category. If they are not one of the first 9 categories on there, then you would select the 10th one, other, not listed above. Hopefully your workers would fall into one of the 9 categories or pretty close. Column C says now how many nurses or how many workers did you have in each of those categories. So I picked a local hospital called Albany Medical Center. This is fictitious information that I made up for this purpose of the webinar. And I said, at Albany Med Center, I placed registered nurses and physical therapists. I did 11 nurses and 22 therapists. So the next column, D, says, tell us the type of pay that you gave those nurses and therapists. So you can see these types of pay. Regular, overtime, hazard. Every type of pay that was given to the worker needs to be identified on its own row in the worksheet. Every pay that went to the worker needs to be identified on its own row in the worksheet. So here, the nurses, if you look at row 1, I had 11 registered nurses at Albany Med Center, and all of them got regular pay. The first 40 hours of each week is called regular pay, and 8 of them received overtime pay, the second row. And then column E says, give me the total hours for all of those people in the quarter. So my fictitious data, you see 200 hours, then 30, then 500 for the physical therapists, and then 0. This all-important 0 hours. Look at row 4. The pay type or benefit that I selected says that I paid the lodging and meal costs. Seemingly they were on travel. Okay. When the pay type or benefit is not hourly, like lodging and meal costs, then you can put a 0 in column E. Take a look. Here are the pay types. The first few are obviously hourly types of pay, right? Regular pay, overtime pay, etc. The ones at the bottom, like fringe benefits, lodging and meal costs, are not hourly. So in those instances, if you have lodging and meal costs or any pay type that is not hourly, you can put a 0 and should put a 0 in column E. This is the only 0 or blank that can be placed on this worksheet. And I'll say that a few times, but that's the only place, the total hours, that can be 0 when the pay type or benefit is not calculated hourly. So the next question, column F, is going to ask us what pay went to the worker. Column F, what pay went to the worker? So I'll read this, but I want to show it to you. So column F, pay to the worker. Okay. You will enter the total amount earned by the workers for the hours reported. Okay. Now, the total pay that went to the worker should be entered using an accrual accounting method, which means what did they earn during the 13 weeks of the quarter, regardless of whether you actually paid them during the quarter. So for example, week 13, they worked 40 hours and you say, but Peter, I didn't mail the payment to them yet. Well, that doesn't matter. If they earned it during the quarter, then that was accrued and you report that pay, even if you're paying them on a 2-week lag and they didn't receive the payment yet. Okay? If these questions aren't explained to your satisfaction, you can always write to us at our mailbox. It will be posted in the chat window a few times. It is on our website. Our email box is on our website at the top and the bottom. And I will post it also at the end of this webinar. So you'll be able to reach us here at the Department of Health and ask questions. So now that you have completed column F, okay, you tell us the pay to the worker. Again, no zeros in this column. The only column that can have a 0 is column E, hours. So you have to identify all the pay that went to the worker. That's what you have to put on this tab in general, is all the pay types that went to the workers. And then the next, if I go to the next slide, you will see column G says, what did I bill the healthcare entity? So I'm going to show you that picture while I read this to you. Okay, so there's column G that you can see on your screen, right? So row 1, Albany Medical Center. I sent 11 nurses, registered nurses during the quarter. They received regular pay for 200 total hours, and there were the 11 workers were paid a total of $95,000. And in column G, my agency billed the hospital or healthcare entity $150,000. This is the detail that is sought on this first tab. If no hours were reported for your row, like the 4th row on here, if there were 0 hours because of the pay type selected in column D, lodging, then report to us in column G the amount that you billed the healthcare entity for the expense in column F for the worker pay. So I made up an example here with some markup, and you can see the first row, 95,000 paid, 150,000 billed, 12,750 paid in row 2, 17,000 billed, etc. There can be no zero in column G. No zeros on this tab except for column E. I promised our website. So if you haven't written it down, here's a quick reminder: health.ny.gov/facilities/staffing_agency. I will show the Excel file that I mentioned. So earlier I showed you this agency info tab, right? And I said there's some pull down menus. You can see pull down menus right here for the quarter. That's the agency info tab. We have now gone as far as this next one called wages and billing. I will click on it and show you the wages and billing tab. And I told you there's a pull down menu for this first, for this first column, there's a pull down menu. And you say, oh heavens, Peter, there's thousands of items in here. How do I find mine? I promised that if you type in a certain word, Saratoga this time, you will get only the outcomes that contain the word Saratoga. So in mine, I was looking for Albany Medical Center, and oh, there they are. I just start typing Albany Medical Center. So we tried to make that a little bit easy for you. The job category, I don't think you'll need to search, but it does work. If I delete what's in there and I start typing registered R, you can see there's the ones with R-E-G, registered nurse. So we can enter that way. The total workers, the total amount paid to the workers, the total amount billed to the healthcare entity. So I'm going to make another point that this worksheet, wages and billing, has to identify all the pay that went to the workers. Peter, what happens if I have items that I billed to the healthcare entity that I did not pay to the worker, like for overhead or in other administrative costs? Do I put that on here? Because then I'd have to put a 0 in this column because I did not pay the worker. No, they do not go on this tab. There can be no zeros on this tab or blanks except right here when you're selecting from the pull down menu the pay types that are not hourly, right? So that's the only time when you can put a 0. Well, where do I identify, Peter? Where do I identify the other amounts that I billed to the healthcare entity that I did not pay to the workers? That's tab 2. So right here in tab 2, now I have notes in my PowerPoint. So I'm going to scroll back to my PowerPoint and show you this tab 2. But here in tab 2 is where you would put all of your other revenue and expenses. So here we go. Tab 2, revenue and expenses. So in this tab, you will enter your agency's revenue and expenses for sending the temporary healthcare workers to New York State entities. Notice at the top that the revenue says these are the amounts. It's your revenue, the agency revenue, the amounts you billed to the healthcare entity. Okay, so conceivably, we put some categories in here that maybe you bill a recruitment fee or a contractor fee. If you don't like the categories that I put in here, notice that you can put your own categories in. Please ensure that you complete column C, which is the description. Column C is the description of your revenue. Down below, you see agency expenses. What's the first expense, the big one? It's the wages and benefits you paid to the healthcare workers. Wink, wink, that should be the amount you identified on tab 1. But you can also tell me about other expenses that you incurred, such as your administrative personnel wages, right? If you don't like the ones that we placed in here as suggestions, you can add your own category as you see highlighted on the screen. You can put your own expense category. Remember to fill out column C with a description of those categories. Tab 3. Tab 3 asks for characteristics of the worker. It wants you to enter the state and zip code of the worker's primary residence. And then in column C, add the county, the New York State county, where is their primary work location. This tab, tab 3, should be one record for each worker. So here's where I can determine on this tab whether you had 1 worker, 10 workers, or 100 workers, right? If you had 10 workers, you should have 10 records on here. If you say, well, Peter, the worker worked for a few months at hospital number 1, and then the contract ended and they worked for a different hospital for the 3rd month. What do I put on here? It asks for their primary work location. So you would put the one that they worked, the location they worked the most. Each worker can only have 1 record on tab 3. So, assuming you brought somebody in for a 3-month contract to New York from Florida, right? So column A would say Florida, right? If you say, well, they got an apartment, I stationed them in New York City, so they got an apartment in New York City. Do I fill out column A with New York City? No, it's their primary residence. So just because they're staying, maybe a traveling nurse is staying temporarily in New York, you fill out their primary residence. Florida, California, Hawaii, if you will. And B is the zip code of that residence, that primary residence. Column C is their primary work location. They work 3 or 4 locations, but pick one, the primary one. And column D is the same job category that you had on the previous tab, which is licensed practical nurse, certified nursing assistant, registered nurse, etc. So you identify what job category. Just a quick note that there are times on tab 1 where it appears tab 1, you identify 10 workers, and then tab 3, someone's identified 100 workers. That creates a lot of confusion for us here. So there should be some parallel structure between tab 1 and tab 3, although we know that tab 1 does not ask for de-identified data. In other words, tab 1 says if they worked at 3 different hospitals on tab 1, you'd identify all the hospitals and the pay they received at each hospital. But tab 3 is 1 record per worker. Okay, I'll move on. Tab 4 is the same as tab 3. Okay, so you see tab 3, that's tab 3 is if they lived in the United States. Tab 4 is for international workers. So if you brought someone in from the Philippines or another country, you would put them on tab 4, not tab 3. So tab 3 is for US nationals. Tab 4 is for international workers. Okay. I'm moving quick on purpose to make sure that we have time and we get through everything, but that's it. That's it for submitting the Excel file. 5 tabs, a preface, which was an agency info tab, and then 4 tabs of information called tab 1, 2, 3, and 4. That's it. We've gone through it all. But now you got to get that to us. You got to get that file to us along with the other quarterly reporting requirements. So how do you do that? You do that in this IBM software called SendVault. I won't spend a lot of time on here only because this is exactly what is on our website. So if you say, Pete, you're going a little fast through this uploading part, I promise you that the same material is listed on our website in that SendVault section on the middle of our webpage. But here's what you do. First, you're going to open the SendVault website that I'm showing on the screen, sendvault.ny.gov. Now, I'm not telling you a little secret that you have to first install some IBM software. There's a IBM Aspera is the name of the software. There's an IBM Aspera extension that you have to load. I don't want to waste time here showing you how to load stuff to your computer. It is identified and documented in our website sheet on SendVault. So you'll load that, then you'll go to the website and you'll see this. You will see the screen that you need to use to upload your information. Make sure at the top of the screen you see temp agency registration at health.ny.gov. There are some agencies that have used SendVault previously, so they might be able to send a package, a new package, as circled on the screen, to multiple places. Maybe other places. We want you to send it to us at temp agency registration. So that should be what you see on your screen once you have the software. Then you'll see a little instructions section. I'll skip past the instructions section and show you the data entry part at the bottom. So it says title with a little asterisk. The title is required. Note is an optional field, and a few other items. So let's look at the title. Here are the instructions, right? I said scroll past the instructions, but here's what it says. The instructions say, when you load a file, please enter this information in this order. Put your agency ID, that TA123, 3-digit number, TA123. Then dash, put your agency name, and dash the contents that you uploaded. Now you can upload the entire package all at once in one giant package. Habitually, we see people that load the invoices so that the contents would say invoices. The blue writing on the screen would say invoices. Or it would say, as the example shows, TA999, Peter Landy Staffing Company or Best Staffing Company, dash 2025, we would be in Q3 quarterly report. You put the title, note, you can put anything in note that you'd like. You can tell us your favorite ice cream flavor. And then you go down to the bottom and you've got to find the files on your computer. So you hit browse for files or browse for folders, either one, and you'll get a dialog box. You select your files, and then right below the browse for files, there's a terms of service. You should read it, accept, and then you can hit the send package button. You've identified your files, you hit the send package button, and a dialog box will pop up and say, wait a minute. In order to use the SendVault, you must establish a passphrase. So everyone, you'll see the passphrase we want you to use in red. Everyone should put temp agency ! as the passphrase just for this IBM secure file transfer. Please do not put passwords on your Excel files. Okay? Do not put any passwords on your Excel files. Don't lock anything that you send to us. Don't change, in fact, don't change the characteristics of the Excel files, the formatting at all. Just enter them into this SendVault. SendVault will request a passphrase for the secure file transfer. It's at this moment only that you use this temp agency ! You confirm by entering it twice, hit OK, and you will see this screen pop up in SendVault. It puts a status on the right-hand side of this screen. If it does not say complete, if it says pending or failed or any other problem, you'll have to do it a second time. I usually doesn't fail, but I have had some inquiries where someone said it didn't work. Maybe they used the wrong passphrase or they selected the wrong file. it should say complete. I want you to be aware that you should be able to get some feedback here that you sent us the file in Sendable. The files, plural. Okay? So that's how to send us the package after you've completed all the information. We do have time left over here that we will continue to answer your questions. And we'll stay on till either the questions end or around 1:55, whatever comes first. In the meanwhile, while you're sending questions and corresponding with the team here through the chat window, I have some other stuff that I promised to show you from our website. So again, here is the website. And if you didn't write it down, I would strongly urge you to jot this down. I'm going to pause for 1 second. So as you see on the screen, that website is full of good stuff. Registration. How do I register each August? Where do I mail my stuff to? Like the check, the payment, okay? Quarterly reporting, all the stuff we went over today. The SendVault instructions. Frequently asked questions. Those are at the top of our website. I'll show it now. Lists of registered agencies. Where's the list, Pete? How do I find my TA number? It's in those lists. And this recorded webinar will be posted there. So if you'll allow me to go back, I will come out of that and back to our website. Right. Here's the frequently asked questions. I know it's hard. It's easy to overlook it right at the top, but you can go there. You'll see that we put them in different categories. If you're looking for stuff about timelines or submission materials, registration, here they are. You open up the section. Here's all quarterly reporting questions. Okay. Here's the article of the public health law. Pete, I want to read the language from the state government. There it is. Okay. I'll go back. Just resources again. Send us an email just to say hello. We accept complaints and compliments. Do we get any complaints? Oh, we only get complaints. Okay. Registration. Here's the form. Here's where to send the registration form and money. Quarterly reporting and deadlines. The files you'll need for quarterly reporting. And these SendVault instructions. Again, if these instructions, after you read them, if you still have a question, send us an email. But here's the lists. Here's the list of everybody. These lists get updated about once a month. So I'm going to click on the most recent one. Here's year 1. Here's year 2. Pardon me. We're in year 3. You can see the last time we updated it was about 4 weeks ago. So if you say, hey, Peter, I registered in the past 4 weeks. My name's not on here. Give us a moment or send us an email. Right? If you scroll down, say, I'm GetMed staffing. Here's my TA ID, just unique identifiers. So you can look yourself up on here. There are 500 records currently. 535. They're not numbered sequentially, so the numbers go up to 754. Okay. I think I've covered all the material, including this all-important website that you should have written down. We're not getting questions. They seem to have tapered off. I will go back here. That's the email address, which is on the website. If you wrote down the website, you can say, Peter, I'm not writing this long thing down. You don't have to write this long thing down. It's on our website. And thank you. Thank you, everyone. I appreciate your time. It is 1:45 p.m. here in Albany, New York, and we are going to end this webinar. Thank you.